The aim of this virtual meeting is to remind lawmakers that COVID-19 is real, and as such, preventive measures should not be taken for granted. The focus is to guide members and show them how they can prevent the further spread of the coronavirus disease at a time where they will be spending more time with their constituents.
We have to learn from the mistakes of people. In this country, we've not done badly, but we should do more to ensure that this pandemic does not, bring more damage to our country.
The federal government, on its part, has done well by setting up the Presidential Task Force on COVID-19 by updating Nigerians on how to conduct themselves. This meeting is to buttress the fact that COVID-19 is real.
At the beginning, we had only about 3 laboratories that can do molecular testing. As at yesterday, the DG happily told us that across the country, we have now about 60 laboratories that can do COVID testing. 46 of them are proper molecular laboratories. 14 of them are laboratories that were upgraded to be able to test for COVID.
Speaker of the House of Representatives, Femi Gbajabiamila, while welcoming honorable members, said the Green Chamber upon resumption will ensure total compliance in curbing the coronavirus disease.
And to encourage our members, including my good self, encourage our members to take this very serious, particularly throughout this break when we're all going to be with our constituents and we're going to be mixing with them and talking to them and felicitating with them. To take this training very serious, and I hope by the time we come back in September, we'll all be healed and hearty, and we will be in total compliance with all the COVID guidelines.
Part of the lessons learned is identifying how the virus is being spread and all they need to know about COVID-19.
There's a lot of information that is not clear about COVID. It's a new virus. We've not seen it before. So there are lots of research and studies ongoing even as we speak to determine exactly how this thing behaves. What we do know is that it's not a very straightforward virus. It's not as simple as some of the other viruses we've seen before. But what we know for sure is that it is transmitted through what we call respiratory droplets. Now, these droplets come out of the mouth of an infected person or the nose of an infected person when they cough, sneeze, laugh, talk, or sing. Any of those things generate these things we call droplets. And you can see in the picture on the screen that these droplets come out of the mouth.
However, lawmakers are worried that the greater majority of Nigerians are careless about the virus.
That bus stop and where people enter vehicle. When we got there, not a single person was wearing face mask. And some more than thousands of people. Even petrol station, nobody is wearing face mask. Just in Abuja here. As we move further, in Lokoja, I never saw somebody wearing face mask. We bought petrol somewhere and I asked why you don't wear face mask. The lady said her face mask is in her pocket.
Since the emergence of the new coronavirus called SARS-CoV-2, several researchers have proposed that there is more than one strain and that mutations have led to changes on how infectious and deadly it is. However, all hands must be on deck.
We must keep and I expect members to pay attention so that we can take something home to the benefit of our country and our constituents.
This is a very, very, very challenging time. We are living in perilous times, and we all have to be careful in the things we do.
Coronavirus are a family of viruses that causes cold and flu-like symptoms in humans. Washing hands and wearing face masks will help protect from the droplets that carry the COVID-19 virus. It is expected that lawmakers take responsibility for their health and for their loved ones.